Good morning, Las Vegas, and welcome to A Healthier Tomorrow. I'm your host, Will Rucker, and we are live in studio. It is so exciting to be here. That number to call in is 702-647-3688. I want you to tell your neighbors, your friends, your cousins, your big mom, let everybody know A Healthier Tomorrow is on the air. The A Healthier Tomorrow program is sponsored by the Office of Chronic Disease Prevention and Health Promotion at the Southern Nevada Health District. September is Childhood Obesity Awareness Month. This is a chance to promote a healthy weight among children and ensure that every child has an opportunity to achieve optimal health. Healthy bodies come in all shapes and sizes. Rather than focus on weight, keep your focus on health and what you can do to encourage and foster healthy behaviors. To learn more, visit www.gethealthyclarkcounty.org. And a special shout out to the Southern Nevada Health District for this sponsorship. Thank you for continuing to support the great work of Community Partners for Better Health. Again, I am your host, Will Rucker, and joining me in studio today, I love saying that, joining me in studio is none other than you're kind of the executive director, but I guess you're technically board chair, but none other than Dr. Charlene Day. Good morning.
Good morning, Will. Thank you for having me here.
Well, I felt like since this was our first time back in studio live, I had to have someone really special, so... So glad that you're here. Hey, we've got a lot to talk about today, but I just want to start off by saying thank you for the service that you provide for our community, for your legacy that you have provided for the entire Las Vegas Valley and really our nation with the work that you're doing. So just gratitude to you this morning.
Thank you. I appreciate it, and it is a labor of love.
Good. So for folks that don't know you, tell us a little bit about you.
Well, I'll tell you about my relationship with community partners first off, because that is, in fact, something that I'm very passionate about. So I got involved with community partners long before there was actually a Community Partners for Better Health. Many of your listeners may recall that the University of Nevada, Reno Cooperative Extension Program had a program that was funded by the federal government, CDC, over 20 years ago. And it was specifically designed by the community. A woman by the name of Joyce Woodson, who many of you may recall, went out into the community, spoke specifically with pastors and other heads of faith-based organizations, and really got the community engaged in determining what was the key health issue at the time. And 20 years ago, as it is today, that issue was heart disease. And out of that came a program that was for faith-based organizations and other health-serving organizations to really get involved and do something about the increasing rates of heart disease in our community. And from that came the passion and programs that were happening everywhere. For a while, you would see our room would be full of people who were just passionate about trying to reduce those scary statistics. And from that, people said, well, there should be more than we appreciated at that time the university's support, but there was a group of people who said this should become a living coalition of people who are interested in making a difference long term in not just heart disease but other issues of concern to our community. Many of you maybe remember, I think it was Larry Gamel back in the day who was very much involved in the starting of that initiative, which became Community Partners for Better Health.
So you've been around since before the inception.
Since before the inception.
And so you've had the opportunity to really shape what this organization has become. And here we are full circle with you at the helm, just leading us into what I love to say is a healthier tomorrow.
You know, that is true. So Will, that I stepped up and stepped into shoes. I have served in, many different capacities. I've been a board member. I've been an advisor through my company, Education for Quality Living. I've always served as the health education component of this, identifying grant sources, securing grant sources for the organization, the coalition, to do what they do. But upon the very sad death of our former chair, Celeste Fomar, the team asked, and I accepted, to become the chair of the organization, which was supposed to be just for 2 years. And we're a little bit past that now, but nevertheless, my passion still remains, and it is the mission of this organization that I think compels me and compels all the other board members to get involved. So just as a quick reminder, the mission is to empower our community. So this is our community with the knowledge and tools necessary to improve health, quality of life, and eliminate health disparities. That's what we're all about.
Yeah, that is so important. And, admittedly, I get a bit frustrated because when I wake up in the morning, like, carrots and celery and kale are not necessarily the thing I'm craving, but because of folks like you, I know that I should start my day with water and with things that are going to fuel my body so that I can be healthier. Could you share just a bit about your perspective on why this show is so important, why people should be tuning in every month to learn more about these health issues?
So many years ago, we started writing grants to be able to sustain some of our programs. And in the process, we learned a lot about how we communicate with our community. And this vehicle, being here at 88.1 and having the support of the health district to get us here, has just been pivotal in our ability to be able to reach people outside of our immediate sphere. So when you have the voice on the radio, and we're fortunate, well, you've done a fantastic job. Thank you very much. When we have the opportunity for people to be able to tune in from the comfort of their car or the comfort of their home or their office and listen to and have information provided that's critical to their health. We bring in experts there have been times when there are experts from around the world, not just locally, and we are lucky to have people locally who just know what they're talking about. This is the voice of the people, and this is the opportunity that we have to be able to reach so many more. We go and we do events in faith-based organizations, and we do all kinds of fun and engaging things, but we're still only reaching the numbers of people who come to those events. In this regard, when we're on the radio like we are today, we're reaching so many more. And so this is the number one way that we can really advance our messages in a quick and easy format.
Yeah, thank you for sharing that. And anyone that knows me knows I believe in promoting health for all people. And it is so important to me that we are doing this for our people. Because unfortunately, historically, we've lagged behind in just about every health metric. We're number one in the areas we shouldn't be number one in, and we're the last on the list for the areas we should be at the top. So being able to share these important nuggets of truth means the world to me. And I think that it is so timely that we're here today because we have a general membership meeting coming up. The first one in how long?
In over 2 years, since COVID.
The first one since COVID. We have the opportunity we are community partners, and so we get to bring our partners together in person to really strategize, to envision, and to remind folks what it is we're here to do. Could you talk a little bit about that meeting?
Sure. So first off, everyone in your listening audience can come and is encouraged to come to the meeting I'm about to talk about, because our general membership is indeed you. If you have a focus or an interest in your health or the health of others and the health of our community, then you need to be coming to the meeting. We are, as we said, a coalition, so there are health-serving organizations and health-serving individuals who come out and support what we're doing and give not only their interest and their passion, but their expertise. So we need you, and we hope that you will attend. So this first back general membership meeting will take place next week on Wednesday. It is our first face-to-face, and you'll have the opportunity to learn more about what we've been up to, and more importantly, how you can become involved. So it's going to be from 8 to 10 a.m. at our partner and sponsors location, the Southern Nevada Health District. Many of you may know that's at 280 South Decatur Boulevard, just off of the Decatur exit on the 95. And we are going to be starting right promptly at 8 a.m. We know that you all have important things to do on a Wednesday morning, and that's next week. 21st, and we have a huge room, and we're really gonna surprise you with some of the things. We have a little contest for people who come, but more importantly, we're going to share with you all of the things we've been up to, as well as give you an opportunity to participate.
Well, I want to give everyone just a sneak peek and a reminder of what we've been up to. We've had, I can't even count the number of shows that we've done at this point, but one that we did was about our reality tour. And this reality tour program has been just life-changing for so many individuals, and it focuses in on substance misuse and prevention, which is something that I'm a strong believer in. I think the best thing we can do is prevent. My grandma used to tell me an ounce of prevention is worth a pound of cure. And so basically, like, if we get it right in the beginning, then we don't have to work as much on the back end. So with Reality Tour, I've been honored to share and be a part of that, talking about vape. Some of you all know I'm with the American Lung Association. I do a lot of our tobacco outreach and our asthma work, but I've been able to partner with you in the Reality Tour, talking about youth vaping, which is an epidemic. But to share what's happening with Reality Tour, because of course we'll talk about it at the general membership meeting, but let us know.
Well, we just finished the third in 3 years of Reality Tour funded by the PAC Coalition. And I have to tell you that the event we did in June was probably our best yet. We were sponsored by two organizations, and one was Les Gyms, Las Vegas, and the other Iron Sharpens Iron mentoring program, which I want to give a shout out to both of them, who sponsored us at their offices off of Jones. And it was phenomenal. We had people who volunteer. So the majority of everything we do with Reality Tour are volunteers, people who either have a passion to talk to other people about substance abuse prevention. So this is not treatment in any way. It's how to prevent this very early on. And it's not for people we often get people coming up and saying, oh, well, I don't have that problem in my family, and my kids this is not an issue for my kids. And I'm very happy to hear that, but that's frankly part of the problem, is that we want to make sure everybody feels that it is part of their problem and part of the community's problem. And you don't wait until there's a problem. Prevention is all about preventing a problem before it happens. So Reality Tour is true prevention, and the things that you learn in Reality Tour are so much greater than just substance abuse prevention. It's about communication skills. So I mentioned in past shows that Reality Tour is actually that. It's a tour where you go on the life of and it's not just you, it's family units that come together. And I think that's so very important. Many of the prevention programs we know of are just for youth or just for parents. In this case, with Reality Tour, you're required to come with a parent, and you go through this really fun experiential activity where you walk through the life of someone who made the decision to engage in misusing substances. And this last one in June was phenomenal. We had people come out saying they had never experienced anything like this before. We had people come in initially saying, oh, I had to drag him or her to this meeting. It was early in the morning, and it's about 2 hours of fun. And as they left, they said, best thing I've ever done. I came out of here with skills that I didn't know I needed, and especially the communication skills. We let you leave with skills that you will use for a lifetime. And just to give you a hint, I don't know how many of you in the listening audience actually have things like an emergency code word that you use with your families. We teach why you should have one. And that goes far beyond talking about substance misuse. That talks about ways of keeping yourself safe.
Yeah, let's back up, because this emergency code word is one of my favorite parts. So don't hold it back from us. Let us know what that's about.
Well, I do want them to come to a Reality Tour and learn all the other things that we teach, but I think that's really an important one, because we really should have, as families and as concerned members of our community, we should have we should be embracing this concept of a family code. And what that does is it gives you strength and power for when you are in a situation that you feel a little uncomfortable and you need an out. If you pick up the phone or if you're talking to someone and you want to be able to communicate in a very private way that you're uncomfortable and want to leave, having this code, this password. Imagine if you call up your parents or your parent calls you just to check on you and you use that word, something that you've created that's just for the use of your family. Only your family, the person who's important to you, knows that code, and they immediately know that means come and get me out of that situation. Imagine how useful that can be. That's just one of the many kind of tips that we give in Reality Tour.
Wow. Yeah, and I see so many uses for that, so many applications. And it really is, that's what I love about what we do is, sometimes you think about health, like I mentioned, the kale and the vegetables, but health is also that emotional and psychological safety, being able to know that if you need to leave somewhere, you have a way to do it where you're not embarrassed, where you're not putting folks on the spot, but you have an out.
That's exactly right. And it is about, I think, the majority of what we do is about empowerment. In this case, we're empowering families and individuals to be able to have tools at their disposal. Sometimes the reason we have the health disparities that we so frequently talk about on this show is because of a lack of information and a lack of tools. And our job, our major responsibility to ourselves and to our community is to impart those tools and that information to the community.
That's exactly it. And I'm so glad you brought that up, because sometimes it can feel like, oh yeah, I've already heard that. I do tobacco cessation a lot. So I'm telling people, you can quit smoking, quit using commercial tobacco. Like that's going to save your life. It's going to make you feel healthier. And because you hear it so often, sometimes it can just become mundane and it just drowns out. But it's so important to be educated, because knowledge really is power. And so this empowerment aspect, I think, is just as critical as talking about knowing your numbers, which everyone should know their blood pressure numbers. And if you have diabetes, you should know where your blood glucose and all those things are. I'm not the expert on those things, but I'm just talking about what other people have said. So, you should know those things. And you should also take the time and effort to learn more. We are a community. And we're only as strong as the most vulnerable among us. So the more that we can educate each other, the more that we can provide these services through information, just through conversation, the better off we'll be.
I totally agree with you. And I think that, you mentioned the kale and apples and things and how we spend a lot of our time talking about nutrition. And we do know, in fact, that diet and exercise are some of the main components to having good health. And the absence of that is sometimes results in some of these health disparities that we're talking about. So I'm going to share with you yet another program, and you are familiar, Will, with the fact that we became the fiduciary agent or the fiscal agent for a program that's been wildly successful here in Las Vegas, and many of you know about it, certainly because I've been on here for many years talking about it. It's Body and Soul. So if you are in the listening audience and you have a Body and Soul program in your faith-based organization, I'd like for you to call and tell us a little bit about what you learned from Body and Soul. If you are a Body and Soul advocate, and you know who you are, we've got some incredible faith-based organizations that have trained people in their congregation to do the work of Body and Soul. Call in and tell us a little bit about it.
That call-in number is 702-647-3688. That's 647-3688.
Thanks, Will. And while we're waiting, I'll just make sure that the listening audience knows a little bit about what Body and Soul is all about. So it's what we call an evidence-based program. Evidence-based is scientific. It means that it's been proven over and over again. It started well over 40 years ago, believe it or not, when a group of staffers from the National Cancer Institute, the Centers for Disease Control and Prevention, and the American Cancer Society got together, and these were staffers of color, and these are African Americans who got together and were really concerned about the increasing incidence and prevalence of, frankly, diseases, including cancer, that had a relationship with nutrition or the lack thereof. So people were not eating properly, and we know that nutrition does have some bearing on these diseases. And they came up with a program called Body and Soul, which was specifically designed for faith-based organizations. And why? Because very often, back in the day, even if we look back to slavery time, people would get information on health and any other area from their faith-based organization. So it might be just when you got together on that one time on a Sunday or another date, then you talked about things, and the head of that organization would impart information and wisdom to the community, and that was a major source of conveying of important facts. So Body and Soul built upon that, and the head of Body and Soul is always the head of the faith-based organization. So it's faith-based, and then they are charged with the responsibility of getting the information out to the rest of the congregation by these health advocates. So we've been doing it now for 20 years here in Las Vegas. We've had as many as 50 faith-based organizations, and for many of you we say that, but also you're familiar with the word churches and other black organizations, that faith-based organizations that were interested in doing something about the health status of their congregation. So Body and Soul is about one thing. It's about eating more. Now, you probably know, and I see you laughing a little bit, well, when you say eating more, since when do we talk about eating more? Well, we talk about eating more in Body and Soul because we're talking about eating more fruits and vegetables, and how you can do that easily and deliciously, and how you could try new ways of preparing food that we have historically eaten, but perhaps not prepared in the healthiest of ways. So Body and Soul allows us an opportunity to be able to teach how you can prepare those beloved, like, let's say, collard greens.
Love the collard greens.
Love the collard greens. But there are ways in which we can prepare it that is so incredibly healthy. And guess what? We do in Body and Soul tastings so that you get a chance. You don't have to go home and do it without having had a chance to actually taste it. You can come by and do one of those little taste testings and see just how good it is. And this, I can assure you that whenever we do it, and there's certain things we're very famous for in terms of introducing people to different kinds of fruits and vegetables and ideas about preparation, they come back and ask for the recipe. So that's just one thing. A lot of the organizations that participate in Body and Soul develop what we call health policies. And the Body and Soul health policy really requires that in our faith-based organizations, there are a lot of events that have food. And way back when, a lot of those events had food that was not necessarily,
well, hold on. By way back when, you mean this Sunday we just had, right?
Well, for some of us. So many of these faith-based organizations develop these health policies that say, if there's going to be a food event under our name, so whether it's a repast or a wedding, whether it's the church picnic or the barbecue, that there is going to be at least a fruit and vegetable option. Now, that's not too hard. That's not too much to ask for. But believe it or not, up until this time, many faith-based organizations don't do that. So with the help of our heads of the faith-based organizations and our committed Body and Soul teams, we get out there and we have some seriously wonderful food. We have some tastings. We teach the same people who are going to be preparing the food in the kitchen. We show them how they can do it a little bit healthier. And we're not asking for people to make a wholesale change. For those of you who most recently may have had fried chicken, we just show you how you can have something else along with that, so that you're making sure that people have a fruit and a vegetable option. And it's fun.
It is. And what I like about this the most is you're not saying, hey, you have to go to a strict vegan diet or anything like that. You're saying, hey, do what you're doing and just add this to it. So just take one step towards a healthier lifestyle. When you have a meal, just add a vegetable, just add a fruit to it, which is so easy because it doesn't take a lot. Just those small little changes really do make a big difference.
That's what we're all about. In fact, when you just said add a fruit or vegetable, we started, many people will remember back when salads were not the thing that would get you excited, right? When you would have maybe iceberg lettuce, which I'm not saying anything at all bad about iceberg lettuce. It is a source of fiber, but iceberg lettuce and maybe a scoop of salad dressing on top of it. Nowadays, imagine what we can do with salads and just have, if you have that just before your meal, it certainly fills you up in the right way, but in the right way. So Body and Soul encourages that. But the other thing, and I'll just tell you a quick story about the other thing we do. We have learned over the years that it's not just about what you eat.
We actually have a caller, so we're going to bring them on the line.
Wonderful.
Hello?
Caller, are you there?
Yes, I am.
Hi, go ahead.
Good morning.
Good morning.
I was listening to your show, and I wanted to know, can you tell me the difference between low blood pressure and high blood pressure?
Well, we sure can. So we have a great show where we talked about this, and essentially low blood pressure is where you don't have enough, like it's too low. So you may be feeling lightheaded or something of that nature. So that's the low side. On the high side is where the blood pressure is too much. So your vessels, and Dr. Day, you can certainly chime in. You're putting too much pressure in the body, which makes your heart have to work harder. Can cause all type of migraines and headaches and things like that. And it comes really when you have sodium will elevate your blood pressure levels. And so that's why when we're talking about these healthy food choices, we do talk about minimizing some of that.
Yeah, and stress also. What's happening is that when you say the low, because I've had the high, and when you say low, what effect is that having on your heartbeat?
What effect is the low blood pressure having on your heartbeat?
Yeah,
So the low blood pressure on the heartbeat, I'm not an expert in that area, so I don't want to tell you anything wrong. But what I can tell you is that essentially when the blood pressure is too low, you're going to be dizzy and you could be lightheaded and that sort of thing. So you don't have enough to really keep you moving. So a blood pressure under 90/60 is really going to be considered the low blood pressure. So those are kind of some of the numbers to know. Caller, thank you so much for calling in.
And I'm going to urge you.
Thank you, because a lot of what I wanted to say before you sign off is that we deal a lot with the high, but then when we say low, no one really knows the effect of what that is. And I had a friend in the hospital once, and I really saved his life. His blood pressure got down to 80 over 40, and I said, oh my God. And I went alarming, and the nurses said, I'm very glad, because low can be very dangerous, more dangerous than high. So that's why I wanted to ask that we need to know what low blood pressure really does to us.
I'm so glad you did, and that is why this is Community Partners, because it's all of us working together, sharing knowledge, bringing attention to these important health issues. We are at the hour of our time, and so I want to thank everybody for tuning in. Caller, thank you for calling in. The Healthier Tomorrow program is brought to you by the Office of Chronic Disease Prevention and Health Promotion at the Southern Nevada Health District. September is Childhood Obesity Awareness Month. It is recommended children get the following daily: 5 servings of fruits and vegetables, no more than 2 hours of screen time, at least 1 hour of physical activity, and no sugar-sweetened beverages. To learn more, visit www.gethealthyclarkcounty.org. I want to say a special thank you to our guest today, Dr. Charlene Day, Chair of Community Partners for Better Health. And I want to say thank you to our listening audience for tuning in. As I always remind you, you are not just a drop in the ocean. You are the entire ocean in a drop, and what you do matters. So live compassionately. Tune in next month.